Hello everyone and welcome to Home Health Sales Secrets. My name is Jimmy Stonacher and I'm the owner of the Stonacher Group. We specialize in helping companies such as home health, DME, hospice companies, rehab companies, pediatric rehab clinics. We've worked with so many different companies in the healthcare industry. Today I want to talk to you basically about home health secrets and how to get more Medicare referrals. This program, this podcast, is for anyone that owns a home health agency, maybe owns a home health company with several locations, is a director of sales, director of operations, or maybe just a marketer or sales rep that wants to get better at selling their products in the market. Look, home health has gone through many challenges over the last 20, 30 years. Right now, there's many things that happen in our markets that we're just so confused about when we go out there to sell home health. So what I've done over my 30 years in this business, I've put together programs to create a need to help you get more business. Now, you're going to hear me say that through our series, the words create a need. Because the bottom line is this: home health agencies struggle each and every day because most of the marketers are not trained, they don't know the verbiage, they don't know anything about clinical selling, which is a must today. It's no longer walking into a doctor's office or a hospital with donuts or a biscuit and things like that, of that nature, and just push food and hope that somebody sends you a referral. Look, hope is not a strategy, and it's going to get you nowhere with getting more and more referrals. So this program, the podcast that I'm presenting to you by the Stonacher Group, is to help those out there that are trying to become a better marketer, better sales rep, and at the bottom line is make more money. Look, you got to ask yourself, how much training am I doing for myself to get better at what I'm doing? There's a lot of secrets in the home health business, and over my 30 years, I'm going to kind of shine the light on some of them and give you solutions to some of these challenges. So hang on with me and listen to our podcast and tune in on a regular basis, and I'm going to be able to help you. If your company is in need after you hear some of our information on the podcast, you can reach out to the Stonacher Group. Our number is 337-281-2189, and we can help you build a better model for your agency to grow that Medicare business. So let's get started. They're only going to be about a 10-minute, 15-minute little podcast. I don't want to bore you too much, but I want to keep you interested. You know, the one thing that we have today, the big challenge, is that every year there's new regulations in this industry. And they come out, and everybody, a lot of times your administrator is like, we have all these different changes. No matter what the changes are, there's one thing that's consistent about healthcare selling or home health selling, is that the bottom line is if you don't get the more business, the doors will shut. So the only way to offset all these changes that occur in this industry is to create a need for your agency to get more business. Look, the government keeps chomping away at our reimbursements and things like that. They'll take off, and all these different things. But the bottom line for marketers, that doesn't affect you. The only thing that affects you is if you will get more Medicare admits this year. So let's go on to finding out how we can maybe achieve some of these goals, and let me help you. You know, the history of home health marketing has always been, let's hire a marketer. We're going to give them a trifold brochure, a business card, and a few dollars for some snacks, and go out there and call on some people that you might know, build a little relationship with the girl at the desk, the MA, or maybe the doctor's nurse, or even the doctor, and let's get some Medicare referrals in the door. And oh, by the way, if you don't reach your number within 90 days, guess what? We're going to have to let you go. That is the old way of doing business. Times have changed. It used to be who's your friend, who's your relative, who's your girlfriend, who's your boyfriend that works at a clinic or a doctor's office. It's not like that anymore. Today you have to be more educated about clinical selling than ever before. We're in PDGM. There are 12 categories that the home health industry deals with. So you got to be smart on how you're going to go be out there and market your programs, because the bottom line is this: some of those diagnoses don't pay as much as the other ones. So you could really pinpoint on who to go after. But the bottom line is this: if your agency is not training your marketers what to look for and how to create that need, you will always be chasing the tail. That's how it is. Another thing, we have a lot of other things that happen to us in this industry. You know, the hospitals. There's a hospital rate, and then there's the rate that we get from a doctor's office. Facilities versus non-facilities. All these things we're going to talk about in this podcast series. You know, so case managers, they handle all the referrals. That's how it used to be. So there was no pre-acute selling because no one knew how to sell the product. We have post-acute and we have pre-acute selling. If your marketers are not trained on how to sell diagnosis and the solutions to those issues, you're going to have a tough time. So let's move forward. Here's another couple of things I want to talk to you about before we get into the nitty-gritty is define your agency. Are you a home health agency that employs sales reps to sell your service? That's how the old model worked. We're a home health company. We're going to hire one marketer or two marketers, and they're going to go out there and they're going to give some donuts, and they're going to get us some referrals. Or are you a sales organization that sells a unique home health service or product that no one else offers in your market? See, one of those answers is too boring to do business with. If you're that marketer that works for the first one I talked about, you're going out there just to, hey, how you doing? Hey, can you send me something? My boss is on me. I need a referral because in 90 days, I'm not going to have a job. But if you're a sales organization and you are really training those marketers and the marketers buy into it, they have a reason to meet. They have a reason to go out and create a need. So if a marketer is going to see 10 to 12 different places a day, okay, that's 60 a week. The closing ratio on home health selling is 10% of face-to-face presentations. Let me say it again. 10% of the total face-to-face presentations. Not a drop by, not a bring a donut, not say, hey, how you doing? Send me something. I'm talking about a real clinical presentation. 10%. So if your rep is seeing 60 in a week, and then, look, I know there's different size markets. We have some markets that you have maybe 12 doctors in the whole town. But if you're in a city like a Houston or a New York or a Atlanta, these cities have thousands and thousands of referral sources. So out of 60, 10% is how many? That's 6 Medicare. 6. Okay, 10%. If you have a face-to-face presentation with a clinical protocol. When I'm talking about clinical protocols, this is what I'm talking about. My company develops clinical protocols. And if you can see up here, this is kind of what they look like. Now, what we do is we design them for companies like yours, and we put your company name on it and all your contact information, and we have different unique selling propositions for your company. Then we train your people to understand how to clinically have a call or a presentation and go out to find that one patient. Doctor, can you identify that one COPD patient that is struggling with mucus buildup? They're not sleeping at night. See, that's a clinical engaging question. If your reps are not taught on how to engage with a physician or referral source, and they just go by and say, hey, here's my brochure, your chances of getting a referral are slim to none. But if you go in and engage with a real issue that the doctor is challenged with, say, for instance, this patient keeps calling in his office 2-3 times a day, they can't breathe, the mucus build up, they're falling from the different medications, they're weak, their blood pressure is low, they've had several falls. What do? What will the home health do to help that physician and help that patient? See, that's what I'm talking about, of really training your marketers on how to have those conversations. So, are you a sales organization that hires unique salespeople to train them and make them and have goals and know how to reach those goals? Or are you just a home health agency that we have a marketer, let's go try to get some business? You see, there's a difference of motivation here. So, let me ask you this. What is your customer service reputation? What do patients and their caregivers say about you and your market? What do the case managers say about you and your products? What do the physicians say about you? What is the word on the street about your agency or you as a marketer? What does Medicare say about you? See, that's the most important one. What does Medicare say about you? Your home care compare scores that come out every 3 months list whether you're a 5-star, which is the best, 5, 4, 3, 2, 1. If your marketers do not use that or know that, there's an issue right off the bat. You need to know what you're rated as in Medicare. One thing in particular is because hospitals look at it. Hospitals, rehab facilities, different facilities look at these markings. They will walk into a patient's room and say, look, these are the 5 that we suggest as a case manager. And what they'll say is, these are the ones with the top numbers. Which one do you want? Look, if I'm going on vacation and I'm going to a hotel or to a resort, I want a 5-star. I don't want a 1. I want a 5. If you're a 3 or below, your agency has work to do. Because that's saying that there's something wrong here. Look, I know there's an easy way to skew those numbers. A lot of agencies still do that. They have people that really sit in their agencies and they're hired to actually look at those numbers and make sure that quality insurance is there. But look, the bottom line is this. You need to get on the ball if your agency is not a 3 and above. 3 is just average. 4 and 5 is up there. Then you have a patient survey. You need to be at a 4 to 5 on that survey as well. Because these things will factor in how you will do business with a hospital or not. And we're going to get to that a little bit later. So you need to know this. You need to look at your home care compare scores and where are you, because that is going to be your lifeline when it comes to the hospitals. They will not do business with you if they have an ACO, an accountable care organization attached to this. They're not going to want to do business with you. A lot of formularies go into these ACOs on who they're going to do business with. So the bottom line is, what is the world saying about you? Are you a great agency? Are you not a great agency? Do we even know who you are? So we have to fix that. And I'll talk more into that a little bit later. Once again, if you need help with your agency, call me. My number is 337-281-2189 at the Steinacher Group. I will be glad to help you through this. Now, let's talk about a reality check. To be a champion home health sales rep or consultant, you first have to figure out who you are. If you wish to become successful at this position or any sales position, you have to overhaul you. Are you prepared to overhaul your company and yourself to be successful? If you're not willing to overhaul your company and the things that you're doing right now that aren't making you successful, then it's time to either sell your agency or get out of the business. If you're a sales rep, if you're a marketer, and you're not training to get better every single day, you're not going to get better. It's like working out with weights. You have to continuously train with weights or exercise to get stronger and fit in shape. Same thing with our business. Your business has to get better. You have to get better as a sales rep. So do you have what it takes? So if you're a sales manager or if you're a sales consultant, ask yourself this: how much money do I want to earn this year? And if you're a sales manager and you're not asking your sales reps how much money do you want to make this year, then shame on you. You should ask them every year, how much money do you want to make in this business? Because guess what? The sky's the limit. I'm sure a lot of you have, you have your salary and then you have like a bonus structure on whether it's, how many Medicare you bring in after a certain number and things like that. Some companies do that. Now, the bottom line is, what are your financial dreams? Why are you in this business? Is it just to say, hey, I got a job? No, you got to get passionate about this. You got to get hungry to make money. Which statement best describes your financial situation? Are you very satisfied where you are? Somewhat satisfied where I am? Am I satisfied but I feel hopeless? I'm completely unsatisfied and ready to make a change? You got to ask yourself, why am I doing this? Why am I doing this? So, how much time do you spend building your wealth throughout the year? How much money do you spend each year on your business, on financial education and training? You as a marketer, how much money are you investing in yourself? You know, we go to the health club and spend $100 a month to be part of a health club that you don't end up going to because you're not committed. How much money are you spending into making yourself a better sales rep? Someone that's actually going to go out there and be a business development person, not just a sales rep. Who do you want to be in this business? Because you can make it happen. The money's there. But you have to be like an athlete. You have to train on your verbiage. Very, very important. Your verbiage on what you say, how you say it. And quick to the point. A physician may only have a minute to meet with you. You've got to know what you're going to say before you walk in. You got to know what is your open and engaging question. What type of patient are you after? See, these things make a difference. If the doctor walks out and you're in that hallway and he says, how can I help you? What you got for me today? What are you going to say? Right at that point. I've been out in the field so many times with marketers that they stand there cold. And they're just like, we get back in the car and I'm like, why didn't you say your open engaging question? Because you winged it. You winged it. When you wing a sales call, it doesn't pan out to anything. You have to be prepared. All right? What is your attitude towards work? Towards selling your agency services? Are you disgruntled? Are you not happy? What describes your reaction when physicians or case managers don't send patients to you? Do you just give up on them? You know why you give up? Because you have nothing to sell them. And shame on your agency and shame on your organization doesn't provide you with materials to sell. So let me ask you this. You're going to see 60 people in a week, 60 referral sources. Are all of them the same? Absolutely not. They're not. You have cardiologists, you have internal med, you have case managers in hospitals, you have oncologists, you have neurologists, you have so many different people to call on, but if you don't have something specific to talk to each one of them, you're going to fail. You're going to get a 0. You have to be prepared, and shame on your company if they're not providing you this. So what best describes, your attitude towards a job? Or the day ahead. Are you excited? Are you tired? Are you confused? Are you angry? Are you full of excuses? Do you feel defeated? Do you feel hopeless? Like, oh my God, I call on everybody, but nobody's sending me any business. What is the value of your sales call? Did you create a need for a home health? Did you create a reason for them to send you business? Are you frustrated? Or are you driven? Or are you hungry? Who you are will determine your success in selling home health. What does your best self look like? Are you a champion every day and everything from your mind, body, spirit? Be honest. Be honest with yourself. Are all these things in this section running on full steam? And I'm going to tell you why. You have to be running on full steam, 100% on mind, body, spirit, because this is actually like a football game. You need to be at a peak level, peak performance level, because there's 4 quarters in a day in home health selling. There's the first quarter, 8 a.m. to 10 a.m. And then quarter 2 is 10 a.m. to noon. And then there's lunch. And then third quarter is 1 to 3, and fourth quarter is 3 to 5. If you are not physically and mentally ready to face this challenge every day, guess what? You're going to fail. It's just what it is. So I'm going to help you with all these aspects of home health selling and creating a need to meet. But I want to leave you with one thing, and we're going to end our podcast right now because we have a lot of information to share with you folks. There was a survey done years ago by physicians, and in that survey, they asked the doctors, what do you want from a home health rep or any other type of rep? This is the 5 things that they want. They want the marketer to be a resource of information. They want you to make them money. They want you to make them look good, save them time, and compliment them. Now, let's talk about resource. You got to go in there with some information that they need, okay? That's going to help them and help their patient. Make them money. By a good outcome, they make money. I don't know if you know this, but a lot of these doctors are paid on what is called a MIP or an APM. If your company doesn't know what that is, give me a call, 337-281-2189, Steinacher Group. I can educate you on these things. The bottom line is this. These doctors are on our portal. Medicare is telling them exactly what they need to do to reach 100% of that payment. If you don't have no clue what that payment structure is, then you're just going in there. You're not helping him you're not helping him or her as a physician or a hospital. You're not making them any money. You got to make them look good. For instance, if they're going to refer a patient to you, and like we talked about, what is the world saying about your agency? If they're sending a patient to you and you don't have a great outcome and a bad experience, well, now you made that doctor look bad because they put their name on you. They referred to you. Save them time. Compliment them. Not going in and say, hey, doc, you look beautiful. Did you get Botox? No, compliment them as part of their practice. Y'all are partners. Be a good partner. Look, create a need when it comes to selling home health. Watch our next podcast. We're going to get more into depth about who we're calling on and who we're selling to. 9 times out of 10, most marketers don't even know who to even call on and why they're not getting referrals. Till then, this information concludes our podcast, and we're excited that you're joining in with us. If you're interested in our type of protocol training, we actually build protocols for you. We actually build the protocols, and we actually build the presentations with the engaging questions for you to ask the physician or referral source about specific clinical patients. Give me a call. Till next time, create a need to sell. That's the only way to make it in this business. I'm Jimmy Steinacher. Thanks for joining us today.